Okay, welcome back into the studio and welcome back to the show. Tim McBride from Washington University, health policy analyst. I think, Tim, you've done a great job in the past of kind of giving us a baseline starting point for these conversations. We'd like to do that again tonight. So first, before we get going too far down this road, the marketplace. Help us understand what it is. We used to call it the exchange, but just real quick, the marketplace is what and how important to the ACA?
Well, it's important. It's not the entire bill, but the marketplace is where many people who are uninsured would be signing up for health insurance. Think of it as an online portal like Expedia or Travelocity, or a place where people can go buy these private insurance plans if they're uninsured.
The difference being, Expedia usually works.
That's right. I mean, unfortunately, it's not a funny thing. The rollout has not been very smooth, unfortunately, at least for the healthcare.gov part of it. And I think one important distinction I would make is the healthcare.gov is what's governing about half the states. And about a half the states are going with their own state exchanges. In Missouri here, we're using healthcare.gov. And it's not been very smooth, as most people know.
We didn't set up our own, therefore we default to the federal level.
Right.
Okay, so get us up to speed on that. We can't talk about this issue without talking about current events. Where do we stand now? Things are changing literally every day this week.
Literally every moment. I expect they're trying to fix the code on it. I don't think there's any way to put it, but it didn't roll out very well with the website. I don't think it's a very good website, but they're fixing it fast, hopefully. And it wasn't able to take the amount of traffic they're getting. It's very cumbersome, and it's not been very easy for people to use it. They say that by the end of November they'll have it fixed, at least for healthcare.gov, and we'll see. That probably won't be too late to make this work because people can sign up for 6 months. But if it goes much past that, we might start having some problems.
It's not the only way to sign up, though, is that correct?
No, people can sign up by calling an 800 number, which will be accessible by the website or other places. You could also sign up on paper, and there are navigators in most states.
We've also seen some people with a little bit of sticker shock once they've gotten in there. Can you talk about that at all? It's more expensive than they expected it to be.
It really kind of depends on what your situation is. Again, some of the people who had individual coverage, which was pretty cheap before, that might have been pretty limited, their plans are going to be going up in price. Other people, the prices are pretty reasonable, perhaps. And I think you have to look at all parts of the bill because you have to go through to figure out what your subsidy is going to be before you really know what the prices are. But especially in some states, the prices can be pretty high. And it varies by age.
And another headline that we should mention too is that some folks had their policies canceled.
Right, and I think this was a sort of under the radar thing. I think most of us who were following this knew that this was going to happen, that there were plans that were so-called not grandfathered plans, is the way to put it, that weren't going to meet the standards under the Affordable Care Act, and then they're now getting letters saying your plan's canceled and you got to go into the exchange. And those bills, those plans might be more expensive for people.
And so that's a lot of different moving parts for a lot of different people, but also a lot of people need to do nothing?
If you have employer-sponsored insurance coverage, if you have Medicare, of course, you probably don't have to do anything. So that's the vast bulk of people. Like, for example, this individual coverage issue we just talked about, that's probably about 5% of the population, so it's a fairly small piece of the population. But that's still millions of people.
People who buy their own, who are buying their own insurance. Talk about the math behind this. How important is it that they get a lot of people? The goal is to get everyone covered.
Yeah, the goal was to get about 7 million people in the exchanges in the long run. I don't know at this point whether that'll be achieved. And the goal was to get young people in there as well as older people, healthy people as well as sick people. One thing I would point out is, for example, in Massachusetts, when this rolled out at the end of the first month, there were only about 120 people signed up. But at the end of the 6-month period, they had 36,000. So that we could see something like that. And the same thing happened with Medicare Part D, that at the end of the first month, there were 1 million people, and at the end of 6 months, there were 12 million people. So many of us expect that this will grow over time. And it's complicated, and it's difficult, and we know with the website, it's not making it any easier.